This evening's case is a 40-year-old, 200-pound Caucasian male that presents experiencing consistent episodes of waking at night, having to use the bathroom, feeling consistently thirsty, weak, and fatigued. The weakness and fatigue is felt in the lower extremities with sense of pins and needles. Onset of fatigue has been consistent for a year with polyuria beginning in the past month, and pins and needles sensation creating a pain level of 2 out of 10, with 10 being a broken arm. The polyuria, polydipsia, and paresthesias, as well as the weakness and fatigue, have been consistent for the last month. After meals such as fast food, the patient complains of feeling a headache, tired, fatigued, and having an urge to urinate as well as drink something. Regarding review of systems, the patient has lost over 10 pounds in the last month. However, there has been no dietary or lifestyle changes. The patient states feeling of fatigue and weakness. Patient denies fever. Patient denies rashes, lumps, or sores. Patient denies dizziness, lightheadedness, or fainting. Patient admits headaches. Patient denies changes in vision, hearing, smell, or taste. Patient denies dental issues, stiff neck, sore throat, or lymphadenopathy. Patient denies any issues with breathing and the lungs. Patient has occasional palpitations, but denies murmurs, swelling in legs or arms. Patient denies issues in abdomen. Patient admits of nocturnal polyuria. Patient denies burning pain or stones when voiding. Patient admits of weakness in lower extremities when walking, but denies joint pain or stiffness. Patient denies fainting, blackouts, or seizures. Patient denies tremors or involuntary movements. Patient denies intolerance to heat or cold, but confirms feeling thirsty. Patient denies anxiety, depression, or suicidal thoughts.
The patient was diagnosed with hypertension 5 years ago, but it is controlled with lisinopril and hydrochlorothiazide. The patient also takes a multivitamin. Allergies include penicillin. He gets a rash. Family history is positive. His father has type 2 diabetes mellitus, but his mother died of breast cancer at the age of 66. He has had no prior surgeries, and his social history includes he works as an accountant and drinks a beer with dinner every night, plus 4 to 5 drinks on the weekend, and he denies tobacco and illicit drug use.
The patient's physical exam is as follows. His vitals were a blood pressure of 118/80. His heart rate was 104. His respiratory rate was 18, non-labored. And his temperature was 98.6 degrees Fahrenheit, taken orally. He is 5'8". He weighs 200 pounds, and his BMI is 30. He is a well-groomed 40-year-old male in no acute distress, and he's alert and oriented ×3. His skin is dry and cool to the touch with decreased skin turgor. There is a small ulceration on the plantar aspect, of his left foot, which is non-healing. His HENT exam is non-remarkable. His cardiology exam shows no rubs, gallops, or murmurs. S1 and S2 is heard. There was no S3 or S4 sounds, and the rate and rhythm were both normal. His lungs were clear to auscultation, and his abdominal exam was unremarkable as well. Neurologically, the patient's cerebellum function is intact, and cranial nerves 1 through 12 are grossly intact. His Achilles reflexes bilaterally were 1+, while all other deep tendon reflexes were 2+. 2-point discrimination is diminished on his lower extremities bilaterally. We did a blood glucose test here in the office, which came back at 220.
So, based on the findings of the random plasma glucose test and the symptoms of polyuria and polydipsia, we've decided to diagnose this patient with uncontrolled type 2 diabetes mellitus. Our treatment goals include lowering his blood glucose level, managing his weight, and preventing complications from diabetes. As part of our 4-step plan, we intend to modify his lifestyle. We've advised him on adhering to the Mediterranean diet, which is heavy in vegetables, whole grains, fish, olive oil, and healthy fats. He was also advised to limit his alcoholic intake to 1 beer a day and to limit the amount of sugary drinks, processed food, and salt in his diet. He will be referred to a medical nutritional therapist for further advisement. He has been advised to exercise for 30 minutes a day, 5 days a week. He could start with walking, cycling, or swimming. If he is successful for 2 to 3 months, we advise him to consider weight-bearing exercises. The second part of our plan includes monitoring. We will monitor his hemoglobin A1C every 3 months with the goal of it being less than 7%. The patient will self-monitor his blood glucose level with the goal of it being less than 130 over 80 millimeters of mercury. As for treatment, we have mechanically debrided the ulcer in the office, and we've covered it with a polyurethane dressing to promote healing. We have advised the patient on proper footwear and ensuring that he keeps his feet dry and check the bottoms of his feet daily for ulcers and sores. For medications, we are prescribing 500 milligrams of metformin to be taken with breakfast and with dinner by mouth. The patient has been advised about the side effects of metformin, such as nausea, vomiting, diarrhea, and abdominal discomfort. Since his hypertension is controlled, he will continue to take his lisinopril and hydrochlorothiazide combo. The patient was also educated on the warning signs of hypoglycemia, such as shaking, sweating, dizziness, hunger, and confusion. He has been told that if he experiences these symptoms, he should suck on a hard candy, and he should have hard candy in his pockets at all times. Finally, we intend to prevent complications. The patient will be given the flu vaccine annually and the pneumococcal vaccine once he reaches 50 years old. He will follow up with his PCP in 1 month to reassess his hemoglobin A1C and to find the results of the CBC, CMP, and 24-hour urine collection. We will then adjust his medications as needed. He will follow up with an ophthalmologist, a podiatrist, and a medical nutritional therapist as soon as possible to assess his vision, discuss ulcer management, and alter his lifestyle.